Obstructive sleep apnea is a disorder in which you stop breathing during your sleep. Apnea means to pause in breathing for a minimum of 10 seconds. Obstructive sleep apnea is due to the muscles in the upper airway or in the back of the throat failing to maintain an open airway during sleep. So the muscles become relaxed and close in, and this causes obstructive sleep apnea. Obstructive sleep apnea, or simply sleep apnea, causes sleep fragmentation and very low oxygen blood levels. The sleep deprivation and oxygen starvation, therefore, may cause high blood pressure, stroke, heart disease, mood or memory loss, such as irritability or depression, learning disabilities, or unable to concentrate throughout the day. It may also cause sexual dysfunction. Sleep apnea is a very serious disorder. People who are overweight are more prone to sleep apnea. The excessive weight on the body puts pressure in the upper airway during nighttime and causes cessation of airflow. Sleep apnea does make it more difficult for you to lose weight. It actually can help you gain weight. When you have sleep apnea and your sleep is so broken up and fragmented throughout the night, your metabolism slows down, and here you can gain weight. Well, sleep apnea is life-threatening. People who have sleep apnea can have automobile crashes. Their daytime performance suffer greatly. And it is a life-threatening disease. It is known to be a life-threatening disease. If you feel that you have sleep apnea, you should consult your physician immediately. Diagnosing sleep apnea can be done through a polysomnogram, which is an overnight sleep study in a sleep center. Here, the patient would be monitored for sleep stages, eye movement, muscle activity, heart rate, respiratory rate, and respiratory effort, as well as blood oxygen levels. This is the best form of diagnostic study. The treatment of choice for sleep apnea is continuous positive airway pressure, also known as CPAP. CPAP is a small machine that sits on your night table and delivers continuous positive airway pressure, or regular air like we're breathing now at a small pressure. The air is delivered through a mask that you would wear on your nose or your nose and mouth. A full face mask may look something like this, covering the nose and mouth. A nasal mask may look something like this, just covering the nose, leaving the mouth free. And then there are other types of masks on the market today that are smaller and least constrictive, such as this, what we call a nasal pillow. This would just gently insert into the nostrils and make a seal there. The idea is that you get the continuous positive airway pressure so that air holds open your airway and maintains an open airway throughout the night. So you have a good quality sleep and your oxygen levels stay at the appropriate level. The first sleep study is to diagnose a sleep disorder such as sleep apnea. If you are diagnosed with sleep apnea, you would have to come back to the sleep center for a second sleep study to have a sleep study with the CPAP machine to see what level of pressure eliminates your sleep apnea and maintains a good oxygen level. After your CPAP sleep study, the doctor will have the results showing what level of pressure helps eliminate your sleep apnea. He then can write a prescription and order the CPAP machine at that level of pressure, and you would receive the machine to use at home on a nightly basis. You should use your CPAP machine every night to eliminate your sleep apnea. If you do not, you will have sleep apnea.